Hello everyone, we welcome you to the 13th episode of Let's Talk Health, an initiative of Star Hospitals. I am Dr. Sindhura Durga, Consultant Medical Oncology and Hemato-Oncology at Star Hospitals. With me today is Dr. Bharat Kumar, Consultant Surgical Oncology, working at Star Hospitals. Today we are here to discuss about ovarian cancer, one of an silent disease in women. Ovarian cancer is cancer of ovaries. It's seen in women commonly between the age group of 40 to 60 years. It's known to be a silent killer because of its symptoms. It presents with symptoms like bloating, vague abdominal discomfort and constipation, because of which it is mistaken as less serious conditions. So we now have Dr. Bharat to discuss more into the symptoms.
Yes, as you discussed, it is like one of the silent killer. So it grows very silently. So many of the people will think that it is where I am getting weight gain, or I am having the pot belly, or there is some kind of dyspepsia. And these are the most of the times people will come with these symptoms only, and they will neglect. And some people will think that it is a normal menstrual to have some pelvic discomfort. So most of the times the people will neglect, and this is diagnosed in a routinely by doing some ultrasound scan done for any other purpose. It's not like patient will have these kind of symptoms, I go for the ultrasound to get my ovarian cancer detected. So they will get this ovarian cyst kind of things many of the times for when they go for any other ultrasound examination. So once we get this ultrasound report as ovarian cyst, so we ask the radiologist whether is it a normal simple cyst, or it is some kind of complex cyst is there. So the radiologist will tell us whether the symptoms of the characteristic features in the ultrasonography. So by that way we will have to suspect that cyst is going to be a malignant one or it's a benign one. Based on our level of suspicion, then we will go further.
Okay, so as we know that the subtlety of symptoms is what is more important in an ovarian cancer.
Yes.
Because the symptoms are the common ones but the diagnosis is a rare one. So it is a responsibility of the doctors as well as the patients to be aware of the symptoms.
Yes.
So can you explain more about the diagnosis of
Yes.
ovarian cancer? How is it diagnosed? What are the various investigations
Yes.
that are usually done
Okay.
to diagnose ovarian cancer?
Yes, ma'am. Once we get the report in ultrasonography of the abdomen and pelvis that there is a cyst in the ovary. So as I mentioned you prior, either it is a complex one or simple one. If we have any suspicion of complex one, we will, to make sure, we will make another investigation as like MRI of the pelvis or a CT scan. So in that we will know the nature of the cyst more, whether it is hemorrhagic cyst or it is a more chance of any solid area is there, for which makes our mind more towards the malignancy. So at that point of time we will also order some blood investigations like tumor markers, what we call it as tumor markers like CA-125 and serum CEA, and some kind of rare germ cell tumors are also there like inhibin, LDH, like that. So in this way we will go ahead with the diagnosis of this one. So once we have the suspicion, there are two things people will call it, whether you are always going to go for surgery or you want to prove it before prove it by a biopsy before going for surgery. The thing is that biopsy of the ovarian tumor is always a controversial one. So many people think that biopsy should not be done. It is not like that biopsy should not be done. We will also do biopsy, but when we will do the biopsy, when we think that the tumor has spread to different parts of the abdomen where the tumor stage is already progressed, at that time we will go and do a biopsy. Why we are doing biopsy? One is to confirm the diagnosis so that we can give some neoadjuvant chemotherapy. So if you don't want to go for surgery directly, at that time I will go and ask my radiologist to do a biopsy, so that I can ask my medical oncologist to give some chemotherapy which will decrease the size of the tumor, and so that I can operate comfortably. So this is how we diagnose this one. Sometimes we don't order biopsy. Why? Because if it is a localized tumor, for example, if it is staying in only the one ovary, it is not spread to any other part. So at that time if we do a biopsy, there will be a spillage of that one. So this will increase the stage of the tumor. So previously it is stage 1 tumor, it may go into stage 2 or stage 3 like that. So we don't want to do biopsy in that time. So the decision of doing a biopsy or not is purely depending upon the doctor's discretion. The surgical oncologist who is going to operate on you, he will decide along with the tumor board, he will decide whether to go for that or not. So in this way I will confirm the diagnosis. If I am going to do operate directly, then the decision is after the chemo, after getting the final histopathology report, we will know the histopathology that is a confirmatory malignancy of ovary.
So as we discussed, for a diagnosis of ovarian cancer, we need an ultrasound scan, a CT or an MRI of the pelvis, tumor markers that is CA-125, and biopsy depending upon the spread of the disease.
Yes.
So once ovarian cancer is diagnosed, so as in other cancers, surgery, chemotherapy and now targeted therapy are all into place for the treatment of ovarian cancer. So we would like to understand what is important in surgery of ovarian cancer. Is it just the removal of ovaries, or is it something else? So what do you think is more important in handling a case of carcinoma ovary?
In ovarian cancer, it is always said that how good the surgery is performed, then the survival benefit of the patient will be more. That is the main thing. So what we have to do what we regularly do in ovarian cancer is we remove the uterus and both the ovaries, and also we remove the omentum and also the peritoneum. So if there is any kind of deposit anywhere in the inside the abdomen, like on the peritoneum and the omentum, and sometimes over the bowel also, we will try to resect that bowel also. Sometimes the ovarian deposits will be there on the rectum, which is a large intestine. We will remove that part, and also we do the anastomosis of that one. So this is the way how we have to treat. It's not just removal of the ovary and cyst, and it's not and the most important is during the surgery we make sure that it will not be spilled. The ovarian cyst should not be spilled if it is intact, like that. So these are the things we have to see. And the complete cytoreduction surgery, it indicates that there should not be any macroscopic disease to be visible in the abdomen. Whatever is there, we have to remove it completely. Then only our chemotherapy or targeted therapy, then only it will work good. So and if we do the complete surgery, that will make the patient more benefit. So there is a survival advantage. That's what I want to say.
So I think it's the adequacy of surgery which is the ultimate in giving the best outcomes to the patients. So it's not just the removal of ovaries and the uterus. In addition to these, there are other structures in the abdomen which needs to be evaluated and removed in entirety. So we should not even leave any disease which is more than 1 centimeter. So removing the disease in entirety should be the goal for any ovarian cancer surgery.
Yes. Okay. So madam, once we remove the ovarian cancer, we do extensive surgeries including omentectomy, pelvic lymph nodes. Sometimes we also do parotid lymph node dissection also. So in such kind of patients, I will send it to the pathologist to get the report. There they will tell that it is for example, it is the parotid nodes are also involved, stage 3, peritoneum is also involved. So depending on that, I will send you for the chemotherapy. So what is chemotherapy, how many cycles you give, and what are the side effects? People usually afraid of chemotherapy, but many people in our hospital or anywhere taking chemotherapy, and they are well and good only most of the times, I believe. So how do you manage these patients, madam?
So in ovarian cancer, because of the common symptoms, majority of the patients present to us in stage 3 disease and sometimes in stage 2. So almost 90% of all the patients of carcinoma ovary would require chemotherapy, and usually the number of cycles that we give is 6. So most of them usually tolerate well. Yes, there can be certain side effects like hair loss and low blood counts, but all these side effects are usually manageable. So surgery and complete 6 cycles of chemotherapy, and that is where is the ideal management of ovarian cancer.
So yeah, what you say is even though there are some side effects of chemotherapy, people need not bother about that, which is now in this advanced era of 2024, we can tolerate, people will tolerate because of the best supportive medication.
Yes.
Okay, right. Madam, I also hear about the targeted therapy in ovarian cancer. What are exactly the targeted therapies?
So targeted therapy is more of an oral medication, that is a tablet form. So targeted therapy has recently been in use in ovarian cancer for the last 2 to 3 years. So once the surgery is done and chemotherapy is completed, we try to give something called maintenance for 2 to 3 years of duration depending upon the various drugs. So these tablets have shown to improve the outcomes and have reduced the risk of recurrence. So these are called the PARP inhibitors, which are recently into use.
Okay, so there are some, this is only tablet form.
Yes.
So this is used for maintenance therapy so that it will decrease the
Risk
recurrence
of recurrence,
Risk
yes.
of recurrence. Okay. Madam, many of my patients will come to me and tell, sir, I have ovarian cancer. My mother is also having a breast cancer. Does my child or my daughter, is she at risk? Whether, how should I know that, and how can I protect her with that breast cancer, any other cancer? So what do you suggest to to them, madam?
So around 20% of all ovarian cancers can be genetic or hereditary.
Okay.
That is, these cancers run in their families.
Okay.
So families carry some mutations which increase the risk of them developing a cancer.
Okay.
So families with these mutations, like the most common one being the BRCA1 and BRCA2, which people must have listened in accordance with the Angelina Jolie phenomenon.
Yes.
So patients with these mutations or the families with these mutations are at increased risk of developing other cancers and not just cancer of ovary. So the other cancers which are at increased prevalence are the breast cancer, pancreatic cancer, the prostate cancer. So what we do is we take a detailed family history, that is, we do a detailed analysis, how many members in the family are affected, what are the cancers that are present in the family, and we advise what is called a genetic testing for them. So a genetic testing is nothing but a blood test wherein we extract the DNA from the cell and it is subjected for a molecular analysis, and the report usually takes around 2 weeks of time. So based upon this genetic testing, we identify whether they are having any mutations or the gene mutations which run in their family.
Okay. Okay. For example, in the example what I have quoted, if for example the mother is having BRCA test positive, she is having breast cancer, and daughter is having BRCA positive ovarian cancer. So that the girl who is now for example 10 years old, so we have to, how to check her?
So once the girl attains the age of 18 years,
Okay.
then we have to test her for the BRCA1, whatever mutation is present in her mother.
Okay.
And for her mother, we would offer, the patient,
Okay.
we would offer some risk reduction surgeries. So that she can be at reduced risk of other cancers.
Okay. So there are two kinds of surgeries for risk reduction, sir. One is risk reducing mastectomy, and another one is risk reducing salpingo-oophorectomy. In risk reducing mastectomy, for the patient who are having breast cancer, BRCA1 gene or BRCA2 gene positive, we will remove the bilateral breast and we will add reconstruction with the implant. And for example, if the patient is having a breast cancer and she is BRCA positive, we also suggest them for risk reducing salpingo-oophorectomy, where we will remove the ovaries and also the tubes. So in this way we can there is a decrease in the risk of 90 to 95% chance of getting the cancer.
So yes, with the onset of genetic testing and the use of risk reduction surgeries, I think this is the way forward to reduce the risk of ovarian cancer, and when it is diagnosed early, the treatment is relatively less complicated and the outcomes are better, the chances of recurrence are less.
Yes.
So it's a way forward towards a better awareness and early medical help, and I think
not
it's more
neglecting
of
the symptoms.
Yes.
What I want to tell is do not neglect your symptoms. Mild symptoms, you need not fix that it is a cancer, but you should go for a doctor and have your gynecological checkup, and this will assure you that you are not having an ovarian cancer, and if there is any problem, you will be at an early stage to detect. Thank you.
Thank you.